Hello friends, I am Dr. Utsav Agrawal, orthopedics and joint replacement specialist. As we know, our knee joint endures a lot of wear and tear due to constant use. Even simple activities like normal walking, jogging, climbing stairs and squatting can add up. Let us know when it is the right time for you to get a knee replacement done, or when is it the time to hold back or wait for some time. Let's face it, knee pain is incredibly common. It can range from occasional pain to a sharp pinching pain to constant throbbing pain. Not all knee pain require a knee replacement surgery. Often, rest, ice fomentations and basic pain-killing medicines are as effective and can do wonders. So when does surgery come into the picture? There are certain indications where surgery is absolutely essential and beneficial procedure for any person. Pain that limits your activities of daily living, activities of daily recreation, that might warrant a knee replacement. Pain at night time, especially which makes you awake from your sleep or disturbs your sleep, is another indication for a knee replacement. Difficulty in squatting, difficulty in getting up from your chair, difficulty in climbing stairs or getting down from the stairs is another indication where a person will benefit from a knee replacement. In early stages of knee arthritis, we usually recommend basic painkillers or over-the-top painkillers may be effective. At a certain point, these painkillers become less effective or are not effective. Usually what we see as the stage of knee arthritis progresses, the requirement of painkiller goes on increasing. That is one of the stages where a knee replacement might be beneficial to cut down on the use of analgesics and get a better quality of life. Another indication for knee replacement is when you see your gait becoming a waddling gait or a duck gait, or you see a bend in your knees. A bowed knees is another indication for knee replacement. With current techniques and technology, knee replacement is not anymore a difficult surgery to go through. Please consult your physician and your surgeon whether knee replacement is the right choice for you. There is no one size fits all and recommendations will be individually based. Feel free to talk honestly and openly with your surgeon about pros and cons of knee replacement for you. What are its benefits? What are your lifestyle expectations after a knee replacement surgery to decide whether it's the right choice for you. If you have any questions on knee replacements or its advantages and disadvantages, feel free to get in touch with us or comment in the comment box. We'll get back with you. Thank you.